Imagine this scenario. A 50-year-old man visits your clinic, struggling with a persistent, productive cough. He's noticed his sputum turning yellowish-green with a strange odor, and it's been affecting his sleep. This simple symptom could be the sign of something common, or perhaps, something more serious. Let's dig deeper into the world of cough and sputum, understand what causes these symptoms, and learn to distinguish their clinical significance. Cough is a reflexive act where the body forcefully expels air to clear the respiratory tract of mucus, irritants, or foreign bodies. This reflex is essential for protecting the lungs and maintaining airway hygiene. Coughing is more than just a quick exhale. It's a carefully coordinated process. Here's how it works. When an irritant triggers the cough reflex, the glottis, the space between the vocal cords, closes, trapping air in the lungs. The respiratory muscles contract, increasing pressure inside the chest. Finally, the glottis opens, and air is expelled rapidly through the upper airways, clearing the irritant with a forceful rush of air. This rapid airflow helps remove mucus or foreign material from the airways and is a key part of our body's defense system. Let's look at some varieties of cough. Dry cough, common in pleural disorders or interstitial lung disease, where there's irritation but no mucus production. Productive cough, this cough produces sputum, which can indicate infections like chronic bronchitis, pulmonary tuberculosis, or even lung abscess. Brassy cough, characterized by a metallic sound, often due to pressure on the trachea from tumors or other space-occupying lesions. Bovine cough, a non-explosive cough that lacks force, sometimes seen in patients with tumors pressing on the recurrent laryngeal nerve. Paroxysmal cough, this is a prolonged, repetitive cough seen in conditions like whooping cough. Barking cough, resembling the sound of a seal, often associated with epiglottal inflammation or psychological factors. These different sounds and characteristics provide crucial hints about the cause of this symptom. Two special types of coughs worth mentioning are nocturnal cough and cough syncope. Nocturnal cough, a cough that primarily occurs at night. Conditions like chronic bronchitis, left-sided heart failure, or bronchial asthma often cause this type of cough, as lying down can worsen symptoms by redistributing blood flow and triggering respiratory reflexes. Cough syncope, this occurs when intense coughing causes a sudden decrease in blood flow to the brain. As intrathoracic pressure spikes during a forceful cough, venous return to the heart is reduced, lowering cardiac output and briefly reducing blood flow to the brain. This can result in a momentary loss of consciousness or cough syncope. Now let's study about sputum. Sputum is more than just mucus, it's a combination of mucus, cellular debris, microorganisms, and even saliva. By examining its characteristics, such as amount, color, consistency, and odor, we can gain valuable insights into underlying conditions. When daily sputum production exceeds 100 milliliters, it's termed bronchorrhea. This occurs in cases like bronchiectasis, lung abscess, and necrotizing pneumonia. Sputum color can vary widely, each shade hinting at different underlying causes. Green/yellow often indicates bacterial infections, as the enzyme myeloperoxidase, or verdoperoxidase, gives sputum its greenish hue. Rusty, seen in pneumococcal pneumonia due to breakdown of red blood cells in the lung. Red currant jelly, a sign of Klebsiella pneumonia, associated with thick, blood-tinged sputum. Black, present in pneumoconiosis, particularly in coal workers. Pink frothy, seen in pulmonary edema, where fluid accumulates in the lungs. Each color offers a unique insight, helping clinicians determine the cause of the patient's cough. Sputum consistency also plays a role in diagnosis. Serous, watery and frothy, often seen in bronchoalveolar carcinoma or pulmonary edema. Mucoid, clear or grayish, typically associated with chronic bronchitis and asthma. Mucopurulent or purulent, often yellowish or greenish, suggesting bacterial infections. Lastly, the odor of sputum, though often overlooked, is a helpful diagnostic clue. Offensive, fetid sputum is typical in conditions such as lung abscess, bronchiectasis, or infections caused by anaerobic bacteria. So, the next time you encounter a cough or sputum in a clinical setting, remember how much information these symptoms carry. From the sound of the cough to the color and consistency of sputum, each detail is like a clue guiding us to a more accurate diagnosis. If you found this breakdown helpful, give us a thumbs up and subscribe to Cephaly for more clinical insights. Together, let's continue building a smarter, stronger future in medicine.